Hello, everyone. I'm Dr. Marty Ross MD, and this is another Conversations with Marty Ross MD tonight. I look forward to seeing what you have in store for me this evening as you create these webinars with your question. I see that there are a number of familiar names, but I also see a lot of new names. So for those of you that are returning, I'm glad to see you keep getting some value and you keep coming back. For those of you that are new here, I want to see what we can do to help you. So the way that you participate, there's a couple ways. Number one, you can see what questions others have. And I will, if you're in the live version, I'll actually post those questions on your screen so you'll be able to see them. But I also read them out loud because they don't show up in the recorded version. To post a question to me, you go to the chat box and write your question there. I ask that you keep them on the short side. If we get too long, I just can't handle those kind of questions in this format, okay? The second way you can participate is to see what questions others have and see how I respond to that. So there's always some good learning that takes place with that as well too. Now, 2 weeks ago, when we last tried to do this webinar, for some reason, my computer did not connect through to the webinar platform. And for about an hour and a half, I responded to every question you all had, or for about an hour and 15 minutes, before realizing I was not connecting. And so I talked to an empty computer or an empty room and an empty webinar, I guess, for an hour and a half, thinking I was providing some good input, but no one got to hear it. And because it didn't connect to the platform, it didn't get recorded. Tonight, though, I think I am connected. At least I hope I am. Everything on this side looks like it is. And so I am creating a recording of tonight's webinar. And my hope would be that my intention is that tomorrow morning, somewhere around 9 to 9:30 a.m. Pacific Standard Time here in Seattle, that I'll get that out to you. You'll also have an opportunity when I send that out to sign up for next week's webinar as well, too. For those of you that think you're getting some good benefits here, realize that other people will get benefit too. So if you happen to know others that may benefit from what we're doing here, feel free to share my emails when I send them out, including the recording of tomorrow's or tonight's event that I send out as a recording tomorrow to you. Okay? All right. So without any further ado, let's go ahead and get started here. And bear with me. I wanted to make sure I really am connected. It looks like I haven't had any complaints here saying I'm not connected. So we'll see how this all goes. All right, so this is the first question. This is from Joe. Joe says, "Hi, Dr. Ross. Thanks for taking the time to answer our questions." You're welcome, Joe. Let's see, if one has strep or staph along with Lyme and Babesia, would the Lyme herbal protocols also cover killing strep staph? I had significant tendon joint issues prior to being hit by a tick, and I think it may have been due to strep from IV drug use, sober 8 years now. Post-tick bite led to worsening of joints, stiff neck, head pressure. Also, any recommendations to alleviate air hunger and heart weirdness from Mallarone? Seems to happen with strong Babesia killers. All right. So in terms of chronic strep or chronic staph, I'm not really clear if there really is something like that. It is true that well, that's not quite true. So for people that have a condition called PANS or PANDAS, one of the causes could be a chronic strep infection that can cause that. And the way we determine if they have chronic strep infection is we measure antibodies doing an antibody test called ASO titers. And if they're elevated and they have PANS or PANDAS means an unexplained acute psychiatric illness that comes on out of nowhere. We think that strep can be a cause of that. We also think that Bartonella can be a cause of that as well too, okay? But in those situations, if we're looking for strep or staph, we're gonna go ahead and do ASO titers to see if that is a situation that somebody has. Now, in terms of what herbs work for that, I'm not clear because I've never tried treating a strep or a staph infection herbally. And it is possible that some of the antimicrobial herbs I recommend might do it, but I just don't know. I don't know. I've never tried to use herbs to treat a strep or a staph infection before, okay? And then let's see, air hunger and heart weirdness for Mallarone. So if you've got tick-borne, or if you've got Babesia, and you start using antimalarials like Malarone or like artemisinin or like cryptolepis to kill the Babesia, it's possible that when you kill, that it will elicit or bring on Herxheimer reactions related to killing Babesia. And what Babesia Herx often can look like is air hunger. It can often look like sometimes skipping or racing of your heart, sometimes increased sweats. But usually after you've been on the antibabesial agents for at least maybe a week or two, that should be lifting. And if it's not, then I would be concerned more about side effect of the Malarone doing something like that, okay? So you might want to talk with your provider if you've been on it for more than a couple of weeks and you're still getting that air hunger and heart weirdness, quote unquote, it might be side effect, okay? All right. And I don't have a simple way around that other than stopping the medication and looking at other alternatives, okay? All right. Good luck to you, Joe. Hello, Steve. Let's see. Hi, Dr. Ross. I've been treating for a while now. I tried lumbrokinase 1 pill twice a day before the serrapeptase 1 pill twice a day with minimal progress for 6 months. Recently, my doctor recommended taking serrapeptase with inulin, and I've been taking a higher dose of that 2 pills 3 times a day and feel like I'm making progress finally, but confused and unsure what to do. Are there any times you recommend serrapeptase or combining it with lumbrokinase? I know you like lumbrokinase. Okay. So it's interesting. I don't know how inulin would be helping this. So inulin is a prebiotic fiber, and so I'm not clear why that would be helping with a serrapeptase, to be quite honest with you. All right, but let's talk about enzymes. So in chronic tick-borne infections, there are a couple reasons to use enzymes. Number one, Bartonella and Borrelia have the ability to develop a slime layer, which is called a biofilm, that covers the germs and can hide them from the immune system and can hide them from antibiotics. Now, this layer that we call biofilm is actually a little bit more intricate than that. It's actually a sugar slime substance called mucopolysaccharides that are held together in a protein skeleton made up of your blood clotting protein called fibrin. Within the biofilm, there's a bunch of bacterial communities that are different kinds of bacteria than tick-borne infections that all do certain functions. Like you can kind of think of the metaphor would be part of it is acting like a post office, another part's the sewage plant, some of it's the grocery store, and all these different germs do different functions within a biofilm community. And many of these germs are not tick-borne germs. They're just other germs that are there, okay? So one of the things that we like to do in terms of trying to break down biofilm, one of the things we can do is to try to break apart the fibrin protein skeleton so that these things fall apart. All right. So another thing that we can do, another reasons we will use enzymes that target fibrin is that Bartonella and Babesia have another thing that occurs, and that is we think that the blood clotting protein, the fibrin, has the ability to wrap itself around these germs, creating germ fibrin nest. This is different than a biofilm. It's a separate issue, okay? And so these germ fibrin nests don't have any of that mucopolysaccharide stuff and all these micro bacterial communities in them. But the trouble is with these fibrin nests is they get stuck on the blood vessel walls, and then essentially they hide the germs there too, all right? So there are some enzymes that we can use that are known to break apart fibrin. We generally recognize that of those, lumbrokinase is the strongest. That is then probably followed in strength by nattokinase, which is then followed in strength by serrapeptase. I will tell you that's a recognized thing. We all say that, all right? But when I've tried to look at any research that justifies that lumbro is in fact stronger than natto, is stronger than serrapeptase, there is no research that justifies it, okay? But I think that I see a stronger effect from lumbrokinase than I do nattokinase, and I think my colleagues do too. So generally recognize that lumbro is your strongest, followed by a natto, followed by a serrapeptase, okay? Now, if you've used a lumbro or you've used a natto or you've used a serrapeptase and you're not getting far enough along, you could try to go to the strongest one, which is lumbrokinase, or it is okay to pair 2 or 3 of these things together at the same time. I have no problem with my patients doing that. A common combination I would use would be a lumbrokinase paired with a nattokinase, for instance, okay? So the way that they would be helping is on either removing biofilms by getting them to fall apart by taking out their protein skeleton, or by breaking down fibrin in these fibrin nests so that the antibiotics can get more at a Bartonella Babesia. So fibrin nests are something that occur in Babesia and Bartonella, and biofilms are things that occur in Borrelia, which is Lyme, and Bartonella. And the way you use your enzymes, lumbrokinase, I like using a 20 milligram pill. That's a product. There is a product made by Candida RNA called Baluki. That is a 20 milligram pill. I usually have people take 1 a day. Sometimes I'll have them go up to twice a day for that. Keep in mind with any of your enzymes that they will digest other things in the stomach, right? So you want to take them on an empty stomach. And so we usually describe to people is you want to stop all medicines and supplements 1 hour before you take and food, 1 hour before you take your lumbrokinase or nattokinase or serrapeptase. And then you can resume them again 1 hour later. Okay, so it's 1 hour either side is generally what I recommend for my patients. Okay, all right. Good luck to you, Steve. Thanks for the question. Hello, Gary. Let's see. I've been on azithromycin, methylene blue, ketotifen, cryptolepis. Recently replaced lumbrokinase and activated charcoal with mycopol and biodisrupt. Not feeling well at all. Could mycopol and biodisrupt be causing a Herx? How do I know when to stop them? Continue until I start feeling better? Question mark. Okay, so let's talk about what a Herx is first, and then I want to talk about what may be happening with you, okay? So when you feel badly in tick-borne infections or mold toxicity, the primary reason you feel bad is that your immune system, in seeing and trying to deal with these invaders, is manufacturing a bunch of chemicals called cytokines. And cytokines are good and bad. On the good side, when white blood cells make a cytokine to get rid of a mold toxin or to turn the immune system on to get rid of Bartonella, that's exactly what it does. These cytokines turn the immune system on. They cause more white blood cells to be made. They help draw those white blood cells to where the infection or the toxin is, and they help bring those white blood cells to where the problem is, okay? So they help your immune system do better. The trouble is in mold toxicity, and the trouble is in tick-borne infections, that often the immune system doesn't do a good job, and it keeps doing harder and harder. It keeps working harder and harder. And to work harder and harder, it keeps producing more and more and more cytokines. And you can develop cytokine excess. Cytokine excess suppresses your immune system, but it also makes you hurt all over, gives you fatigue, makes it so you can't think, interferes with how your hormonal systems work, et cetera, disturbs your sleep, okay? So in tick-borne infections and in mold toxicity, when you feel badly, it's because you have cytokine excess, all right? Now, when you start killing a germ, when you get excessive killing of a germ, or you start, well, excessive may not be right. When you start killing infections, in Bartonella, Borrelia, and even Babesia, when the immune system sees the dead bug parts, it's going to trigger a greater production of cytokines, all right? And that is what's called a Herxheimer reaction. So an increased production of cytokines due to germ killing is a Herxheimer reaction. And what you'll see is a worsening of your underlying symptoms that we already know are from excess cytokines. So if your type of your presentation of your illness is predominantly brain fog and body pain, those would be caused by cytokines. That means that your Herx will probably be worsened brain fog and worsened body pain. Okay, that's kind of what happens. All right, that when you start pulling toxins out of you with a charcoal or a mycopol, There's a different phenomenon that happens, which is the act of moving toxins through your body. The immune system will see that and make more cytokines. And so you will feel worse from a cytokine surge. But here's the technicality of it. A Herxheimer is only due to killing germs. It's only due to cytokine increase from killing germs, okay? Versus when you feel worse from moving toxins around your body from a mycopole, it is true. That is also a cytokine surge, but because it's not killing germs that's causing that cytokine surge, we don't call that a Herxheimer reaction. We just call it a cytokine surge, okay? All right. So let's see here. Let me see what your question was. So the truth is mycopole, by moving toxins around, may be triggering greater cytokine production. Biodisrupt, which has a number of enzymes in it that break down biofilm, and some other herbs that help impact biofilm, may be exposing germs, so you're getting greater killing. So you could have two things going on here: cytokine surge from mycopole and Herxheimer cytokine surge from adding in the biodisrupt and greater germ killing. All right. Generally, I try not to do too many moves at the same time, because then you don't know which one's doing what. In a situation like this, if it seems to be excessive in how bad you're feeling, you might drop one of the new things you did. You might drop the mycopole, or you might drop the biodisrupt until things stabilize, and then go back and add it again, okay? Generally, a Herxheimer reaction should resolve within about a week or two. Generally, a cytokine surge from adding in a new binder should resolve within about a week or two. Okay, they should. All right. And if they're not, then you need to back down, definitely. Okay. All right. Good luck to you, Gary. Hello, Eloise. Let's see. Hello, Dr. Ross. I have two questions. Number one, I noticed the pendulum Akkermansia probiotic very low on my kids' recent gut tests. Contains a significant amount of inulin. Given bacterial overgrowth and possible SIBO, would you recommend starting at very low doses or using a pasteurized postbiotic Akkermansia instead, or simply focus on supporting it through diet? Number two, neuropathy, Bartonella related, while not yet treating BART, anything that could help alleviate the burning sensations? Thank you. Okay. So regarding the inulin, so the pendulum product, Pendulum Akkermansia, has Akkermansia, which is a bacteria that is found in everyone's or should be found in everyone's intestines. Some people don't have a lot of it, and then you should start replacing it, okay? It is one of the key bacteria that are useful at producing mucin, which is the mucus lining that covers your intestinal cells and helps limit leaky gut or prevent leaky gut. In addition, Akkermansia will use polyphenols in your diet, which are chemicals that come from purple, red, and blue colored fruits and vegetables. And coffee as well too. Polyphenols feed Akkermansia, and they will use that. Akkermansia will use it to create short chain fatty acids, and which some of those would be things like butyrate, for instance, that are very useful at helping heal leaky gut by giving fuel sources to your intestinal cells, okay? So Akkermansia, live Akkermansia, is a good thing. And the one thing you get with live Akkermansia is it actually creates the mucin layer, versus dead Akkermansia does not create the mucin layer, okay? Dead Akkermansia may have some signals in it that promote other healthy bacteria to grow well in your intestines, but you don't get the mucin producing benefit of dead Akkermansia compared to living Akkermansia, all right? Now, the inulin that is put in that product is a prebiotic, which is used as starches that are used to fill healthy bacteria. And yes, I agree. If somebody's got SIBO, often they are not going to do well by giving inulin or prebiotic sugar fibers. So it would be ideal if you could find an Akkermansia that doesn't have inulin. I am not aware of who manufactures an Akkermansia without a prebiotic in it, though, unfortunately. So I'm not sure. If I had a chance to search for it, I might be able to find it. I'm just not sure what that product would be. Okay. All right. Yes, you could use a dead Akkermansia, which is still going to do some things to promote healthy bacteria within your intestines, but you're going to be missing one key component of living Akkermansia, and that is living Akkermansia creates this mucin layer that covers the intestinal cells to protect them and keep things from leaking through. Okay. All right. All right. Regarding the neuropathy, so if you are ultimately, if it's neuropathy is related to a Bartonella infection, yeah, you got to kill the Bartonella. However, even if you're killing it, or even if you have to wait to kill it, there are some things you can do to start nerve repair. All right. And so your nerve cell membranes are made up of a double layer of fat, a bilipid layer of fat. In addition, all of your nerve cells have in them mitochondria, or every cell has mitochondria. Mitochondria are the energy factories found within our cells, okay? In neuropathy, we recognize that if you have neuropathy, you have damage to your mitochondria, and you likely have damage to the bilipid layer that makes up the nerve cells as well too. Now, the mitochondria have a bilipid layer too, and that gets injured as a result of oxidation from having infections or mold toxins in you. It's the same thing that damages the cell, the bilipid layer of the cell as well too, all right? So what I like to do in people that have neuropathy, regardless of whether I'm killing their Bartonella or not, I like to support healthy nerve cell membranes, and I like to support repair of damaged mitochondria membranes. And so the product I like that is designed to do that is a product called ATP 360 by Research Nutritionals. It has a blend of phospholipids that is intended to repair the mitochondria membrane, but also would likely repair the nerve cell membrane as well too, all right? In addition, the product has a number of micronutrients in it that help your mitochondria work better. So it's got some coenzyme Q10, some NADH, and then it has another component which is called pyroquinolene quinone, or known as PQQ. And PQQ promotes mitochondria biogenesis, the production of more mitochondria, which can help give more energy to your nerves so they start working and you can recover, okay? So that ATP 360 product, I like to have people take it as 3 pills, 1 time a day. Research Nutritionals has done some limited studies on it that have shown greatly improved thinking and greatly improved energy levels when somebody uses this product as well too, okay? Second thing I like to do is to decrease oxidative damage and prevent further oxidative damage to the nerve cell membrane as well as the mitochondria. And what I like to use to do that is glutathione. And I like using liposomal glutathione. So glutathione, many of you may know, is the major antioxidant or detox chemical made in the liver. It also is very strong antioxidant, all right? And it happens to be made in every one of our cells to limit and repair damage. The trouble is your mitochondria don't make it, a lot of it, okay? And so if they have been injured, they will exhaust their own glutathione gas tank, and it will be hard to replenish it so that they can repair. So I like adding glutathione in here to help refill the mitochondria gas tank, if you will. And the way to do that is a product also made by Research Nutritionals. Its product is called Tri-Fortify. It's TRI-FORTIFY. They have watermelon. They have a citrus flavor as well too. And you want to do a teaspoonful of it 1 time a day. And with that product, Research Nutritionals has some good studies showing great absorption. That's the problem you're going to run into with most glutathione products. They're not well absorbed. But Research Nutritionals has done a good job designing it, and they've shown marked increases in research in cellular levels of glutathione with their product, okay? Number two, they've got good studies showing decrease peroxidative or oxidative damage to the lipid membranes when people are on that product as well too. All right, so this is a good product. Both of those are Research Nutritionals products. The ATP 360, 3 pills 1 time a day, supports healthy mitochondrial function, supports healthy nerve cell membranes, and then the tri-fortified liposomal glutathione also is a great antioxidant that can help repair from the inside and fill up the cellular and mitochondrial glutathione gas tank. Okay, all right, that's a lot of stuff. Good luck to you, Eloise. Let me just do a quick screen share here. I want to show you all a few things that we've been talking about here. Let's see. Oh, there it is. All right, so this is my Lyme information site, Treat Lyme by Marty Ross MD. If you're ever wondering what can you do for neuropathy, for instance, without waiting to talk to me in a webinar, just type in my search bar, neuropathy. And you'll see, here's this article, Peripheral Neuropathy Evaluation and Support in Lyme. All right, so take a look at that. I also talk about a number of tests you should do to make sure that your environment is set up to help with the neuropathy as well too, okay? And then in terms of the Tri-Fortify that I was telling you about, there's a number of options. If you want to read more about the Tri-Fortify, you just click on that. It'll bring you over to my product page, all right? And so this is the Tri-Fortify product. I no longer directly sell products, but I have an affiliate relationship with a company called Phimologist. They carry everything I recommend. It's where I have my patients get their products. And after you read my in-depth product descriptions, I have more detail in my product descriptions than them. If you want to buy, you would just click here. And if you go through my site like this, there is a 10% discount that you get as well. Okay? All right. And then let's see here, the ATP 360 product I was telling you about. That's this product right here, okay? All right, and I think that takes care of it. And then let me just show you one other thing. So this is the Phimologist site, all right? And again, they carry all of my products here, all right? So if you ever want to just go ahead and do it, this is where you're going to get it. This is not, some people when I changed so that I had a relationship with Phimologists were worried about clickbait. This is not clickbait. This is real. This is an intentional arrangement that I have, and I welcome your business here as well too. Okay? All right. Let's go back here. There we are. Okay, good. All right. Let's see here. Hello, Joan. Let's see. Dear Dr. Ross, thanks for all you do. You're welcome. I'm due for a retest with real-time labs. I have done retests before and did not do any test preps except take glutathione, which I was taking anyway. Recently, I have read a urine mycotoxin test prep from a mold-literate doctor. She advises on a specific elimination diet for 3 days before the test, avoiding food beverages that might contain mycotoxins. It is my understanding that this is to differentiate that the mycotoxins are from the body as opposed from foods that we eat. If this can't be done, then do serum antibody test. She uses 3 color guard supplement that night before and the morning of the test to enhance kidney clearance, alternatively provoke with the sauna. This protocol advises to collect the first morning urine plus 6 hours and thoroughly mix the samples and send to the lab. I don't believe she uses real-time lab. I appreciate your thoughts on the above. So this is a protocol by Dr. Jill Krista. And my understanding, she does do real-time lab. She'll also use Mosaic, and I think at times she'll even look at doing Vibrant. And so I have talked with her directly about her protocol. So first of all, there are some providers out there that have suggested that the way to provoke mobilization of your toxins, so you have a greater chance of peeing them out when you do this type of testing, is to do glutathione. And I have never understood why anyone recommended glutathione. Glutathione has nothing to do with detoxing mold toxins out of you. And I actually talked with her about this about 3 or 4, maybe 4 or 5 weeks ago. Jill and I talked, and she agrees. She doesn't see the benefit in doing that either. So I was glad to see that she agreed with me on that. Now, I do disagree. I like the fact that her color guard may enhance kidney clearance. To be honest, though, we don't know that it really is going to change the end outcome of the test. But if you want to do that, that's fine. I don't see any reason not to do it, okay? And I also agree that if you want to try to provoke, sweating or heating up is a useful thing to do. You can do that with a hot bath the night before. You could do it with a sauna the night before. And what that'll do is that mobilizes toxins out of your tissues so they get in the blood so that you have a better chance of peeing them out, okay? I disagree with her, though, that you need to necessarily avoid certain foods the day before. And although I understand that some foods, like your grains, may have ochratoxin, may have aflatoxin in them because of being contaminated grains, when there has been a study done by a lab called Mosaic Diagnostics that also runs a urine mycotoxin test. And in their study, they actually had people binge eat on contaminated grains, and then the next day collect urine samples to see, did it really register high levels that we would see with somebody that has full-on mold toxicity, okay? And the answer is it did not. It was just minimal registration of these toxins from food. I think the whole food toxin argument is way overblown. The levels that you would get out of food do not come anywhere near the levels you're going to get from poisoning of your environment. And these labs, Real-Time, Vibrant, Mosaic, their threshold of levels where they determine you have toxicity are well above the levels of toxins that you might get in small amounts from contaminated grains. So I don't agree with Dr. Krista when she says you have to do this by avoiding certain foods the night before. And although I understand her color guard supplement has the intention of helping to clear things through the kidneys a little bit better, it's not clear to me that it really enhances it enough to warrant going ahead and doing that as well too, okay? I do agree with her, though, that sweating or heating up the night before is a good thing to do. And I think you could make an argument that a longer urine collection has a greater chance of finding these toxins. So 6 hours, fine. I think also a spot urine is fine. I don't think we have any studies that show that a 6-hour collection is any more efficacious than just doing a random urine first thing in the morning. Okay, we don't have that. I understand her opinion about that, though. Okay, all right. Anyhow, there you go. Thanks, Joe. Good luck to you. Renee says, hi, Dr. Russ. Hello, Renee. Hello, Lynn. Let's see. Hold on here just a minute. All right, let's see. Lynn says, had chronic Lyme, Babesia 20 years ago and was very sick for 8 years. Fully recovered except for chemical and mold sensitivities, leading otherwise normal life. I just had IGeneX testing come back positive for Babesia FISH and borderline positive for Babesia microti, and all other tests negative for Lyme. Bartonella FISH and antibodies and ehrlichiosis. Tested because now at 65, starting 3 years ago, each year I have had a virus. Only once was COVID and tested negative for long COVID. Each time after acute illness passed, I had debilitating bedridden type fatigue for 6 to 8 weeks. Same thing happened after exposure to wood smoke and very strong fragrance and a long Uber ride. And those 2 times I also had profuse clear mucus along debilitating fatigue for many weeks, sparking discussions about possible mast cell activation syndrome. Please comment on all of these and advise especially regarding treatment for Babesia and if this is likely the culprit causing debilitation. So it's a good question. I'll give you some thoughts. I would want to probably spend more time asking you some questions here too. So the IGeneX has a Babesia, what's called FISH test. And the FISH test is a microscope exam where we take a fluorescing agent and attach it to the genetic material of Babesia so we can see it under the microscope, okay? And so that's known as a direct test. You directly see the germ, all right? There's another lab out there that's also doing the same kind of direct test, and that is a lab called T Labs. Dr. Bob Mosignani is doing FISH testing, although he doesn't call it FISH testing, but he's doing a microscope exam using the same FISH technique, and he's doing it for Babesia genus as well as for Babesia oticoli. He's also doing it for Bartonella genus, and he's doing it for Borrelia as well too. All right. Now, the other testing you mentioned here, which is the antibody test, the Babesia microti IgM, is an antibody test. It's looking to see has your immune system made antibodies to get rid of an infection, but making antibodies does not prove an infection is in you. It still could be, or maybe it's gone, okay? So the thing I can tell you is you got clear evidence that you have Babesia in you, all right? But then here's the hitch. Having a germ in you does not mean it's causing a problem. Now, that may be a hard thing to understand, but I just want to explain that. It is possible that we can have germs that live in us that we cohabitate with, that our immune systems do a good job keeping under control. And therefore, we don't have symptoms from that, okay? The reason I raise that is classic Babesia is going to have symptoms, the following symptoms. It's often going to have ongoing fatigue. It's often going to have some racing or skipping of the heart. It may lead to some air hunger. It may give you night sweats. And so if you were to have a positive Babesia FISH and have a number of those symptoms, I would say absolutely treat for Babesia. But if you don't have a lot of fatigue and you don't have air hunger or headaches or racing or skipping of your heart, or at least 1 or 2 of those kind of symptoms, then I would question if Babesia is a problem to you. Okay, I would just question it. On the other hand, here's the other hand part of it. It is possible that if you have Babesia that your immune system is trying to keep under control all the time, and then you get another infection, that other infection kind of causes your immune system to take the eyes off of Babesia, and it makes it harder for you to recover and keep Babesia under control. And it may take 6 to 8 weeks to get your Babesia back under control again. Maybe that is what's happening, okay? So I think in a situation like this, if you were not finding any other reason to explain a decline with each virus infection, I would consider and discussing with you possibly treating for Babesia to see if it would make a difference, okay? Additionally, I would be wanting to do some things to boost your immune system so that when you get repeat virus infections, it's in a better place to handle them and not knock you down. And in general, what I have found to be useful for doing that is to take a mix of mushrooms. And usually for this kind of situation, I like using reishi mushrooms, about 400 to 500 milligrams 3 times a day. And I'll just have people take it regularly as a preventative. Alternatively to that, you could use a peptide product that sometimes can be beneficial at keeping your immune system revved up all the time to deal with these other things. And that would be a product made by Integrative Peptides I like using for situations like this is called Thymogen Alpha-1. and I'd have people take 1 pill twice a day of that as an alternative to doing the reishi mushrooms that I was just telling you about, okay? All right, then the other thing I wonder, so again, I'm wondering if maybe Babesia is preoccupying your immune system, making it so that you get viruses a little bit more easier, and because of immune suppression from dealing with Babesia, immune suppression related to fighting viruses, then the immune system has a harder time keeping your Babesia under control, which is why it takes 6 to 8 weeks each time for you to recover. I wonder. I have no way of proving it. I wonder, okay? All right. The other thing, when people have a lot of chemical sensitivity, there's 2 things to wonder about. And one is mast cell activation. And mast cell activation syndrome could be triggered by chronic Babesia. It could also be triggered by mold toxicity. It could be triggered by chronic yeast in your intestines, all right? So I would explore, and have you explore with your physician, do you have too many yeast in your intestines triggering that? Do you have possibility of mold toxicity? Have you looked for mold toxicity? Have done urine testing to look at that? I would consider doing those 2 things as well too, okay? And then the other thing that when people can be reactive like this that I like to do is to do some limbic system retraining. So limbic system is a part of your brain that can governs our fight or flight reactions. It governs our autonomic and sympathetic, parasympathetic nervous systems. It governs whether we eat. It governs whether we try to reproduce. And when we have people with chronic infections, or had chronic infections, the limbic system gets turned into a high alert system, and it reacts more quickly than we might want it to, okay? And so there's ways of retraining it to calm it down. There are 3 programs out there that people will use these days. One is a program called the Gupta method. Another one, or the Gupta program actually. Another one is Annie-Hopper dynamic neural retraining system. And then a third one is Primal Trust. The one that's got university independent backed research showing benefit is Gupta. Primal Trust and Annie-Hopper do not have independent research verifying they're effective. Gupta, on average, shows by doing his techniques that are designed to reformulate anxiety-provoking situations, calm your agitated nervous system, and balance out your autonomic nervous system. That generally when people do Gupta, research, independent research says 50% improvement in symptoms, right? And so it's starting to become, having people do a Gupta method or a Primal Trust has started to become kind of a cornerstone in my practice. There's nothing else I can give a person that has a 50%, that's going to decrease their symptoms by 50%. I can't give you a pill that'll do that. This is some powerful medicine to do the limbic system retraining, especially if you have chronic illness. Okay. All right. Now, I choose Gupta over Primal Trust. I know a number of people are migrating towards Primal Trust because Primal Trust is a little bit stronger than Gupta on the retraining of your sympathetic, parasympathetic nervous system. Primal Trust says they also get about 50% improvements, but is based on their own observations of patient questionnaires. It's not independently verified. Okay. All right. All right. Good luck to you, Lynn. Let me just do a quick screen share here. Show you a few things. All right, so look over here in my Lymology guides, and I want to look in the immune system section. All right, so you may take a look at this article called Sensitivity, How to Manage Extreme Sensitivity in Lyme or Mold Toxicity. This gets into some of your reactivity you're having around smells as well too. And it's in this article that I also talk about Primal Trust, Gupta, and Annie-Hopper dynamic neural retraining system. Okay, so take a look at that. If for those of you that are wanting some more information, it's a good source to look at. Okay, and then the other thing I would show you is this product by So this is the peptide that I like using as a good immune balancer and booster. This is the Thymogen Alpha-1 bioregular complex by Integrative Peptides, okay? And when you click on this button here, by Integrative Peptides, it's going to bring you over to the Integrative Peptide site, which is here. And I have an affiliate relationship with them. They have all the peptides I want. And so feel free to buy through them as well. Okay. All right. And then let's see one other thing here. Yeah. So when you go there, if you enter this code Marty Ross MD right here, you'll get, if it's your first time going there, you're going to get a 10% off price on it as well too. Okay. All right. Let's get out of here. Okay. Hello, Shauna. Let's see. Marty Ross, is it okay to take cryptolepis, Japanese knotweed, and cinnamon clove oregano oil every day for years? Do our bodies get used to it and we need more, or does it build up in our bodies and we eventually need less? Anything else we should know? All right. So I have had, in my practice, let's talk about active and preventive treatment with herbal antibiotics. Okay. So when I'm trying to treat somebody to get them over or manage them to get them over active tick-borne infections, I will use the crypto, the Japanese knotweed, cinnamon clove oregano at full dose, right? So for Babesia, cryptolepis, I would do as a teaspoon 3 times a day. If I'm using crypto mainly for Bartonella and Borrelia, I'm going to do a half teaspoon 3 times a day. That's a full dose, okay? The Japanese knotweed for Bartonella and Borrelia, I'm going to use at 30 drops twice a day. That's what I call full dose, okay? And the cinnamon clove oregano capsules, which I'm going to use for Bartonella and Borrelia, and also the clove that's in there will help with Babesia as well too. I'm going to do that at 1 pill twice a day, okay? Now, after I've gotten somebody well, if they are a person that has relapsed before when we've stopped treatment, I might think about leaving them permanently on crypto, Japanese knotweed, and cinnamon clove oregano. The idea is that you're leaving them on something to keep the germs from getting active again, right? Because when we get some people well, we do actually, in fact, knock all the germs out in some people. There's other people that we get well that the germs may still be in them, but we've knocked the germ load down enough that the immune system has it under control. But there still is always a chance that those germs may come back, all right? Now, we don't have decent testing that tells us at the end of treatment whether we got rid of every germ. We just don't have that kind of testing. So if somebody relapses within the first 2 years, they are a person I'm wondering is going to have problems with relapse again. And those are people that I would leave long-term, years, on a crypto Japanese knotweed cinnamon clove oregano. And the way I would do it is at half dose. So if I was using their crypto at a teaspoonful 3 times a day, then I would probably, in a preventive mode, I would do it at a half a teaspoon 3 times a day. The Japanese knotweed, I do it 15 drops 2 times a day instead of 30 drops 2 times a day. And the cinnamon clove oregano, I would do it 1 pill a day. Okay. Can you do it for years? Yes. All right. Now, in active infection, if you've been on these herbs and you've been on it for a year and you're still getting improvement, great, stay on them. But if you're getting out a year or more and you're just not improving that much, then it's time to look at an alternative herbal or prescriptive antibiotic regimen. But when you get back to considering, do you want to do preventive treatment to prevent relapse in the future or preventive support to prevent relapse in the future, then you could go back to using these even if they previously had not been working to wrap up your whole treatment. Okay? All right. I hope that answers your question for you. Good luck to you. Hello, Rebecca. Let's see. Hi, Dr. Marty Ross. Thank you very much for all your help. You're welcome. I've had chronic Lyme and Bartonella 15 years and failed antibiotic treatment 10 years ago. I just started herbs and it is helping. What do you recommend for painful and congested lymph nodes? Are there any herbs you suggest? Also, what do you recommend for next day fatigue after very light exercise? It feels like a very heavy body, especially painful and heavy muscles. Okay. So in terms of the lymph nodes, Bartonella is known to cause lymph node swelling and an increased size of your lymph nodes. And so that's probably is coming from Bartonella, all right? And you may notice as you're killing Bartonella, because you're sending more dead Bartonella parts to your lymph system, that you may have more pain in those areas. In terms of what to do for it, it can decrease some of the inflammation. And I like using, to decrease that inflammation, I like using curcumin. I like using a Thorne curcumin product, which is a liposomal curcumin. Thorne calls its liposomal curcumin phytosome. It's a 500 milligram pill, and I have people take one pill 3 times a day. Now, if you decide to do that product, I just want to warn you, Thorne's got some weird labeling. If you look at their bottle, it says 1,000 milligrams on the front. However, the serving size is 2 pills. So each of those pills is a 500 milligram pill. But you might want to start doing that as 1 pill 3 times a day. It will lower the inflammatory cytokines that are occurring within your lymph nodes that are leading to some of that pain. Okay. All right. At least I think it will. All right. All right. Then in terms of the fatigue the next day, so there's a common phenomenon that happens in people with tick-borne infections, chronic fatigue syndrome, fibromyalgia, long COVID, and that is post-exertional malaise, where after you've exerted yourself, you wind up doing worse the next day, okay? Now, there's a number of reasons this can happen, but the primary ones are is having some degree of mitochondria dysfunction triggered by the illness. So you have your power plants aren't working well enough to provide you the power, okay? And then in particular in long COVID, or if you had COVID in the past, COVID, even a year, 2 years ago, disturbs production of a chemical in your intestines called serotonin. Now, many of you may know serotonin up in the brain is being your antidepressant chemical, right? That's what we use the SSRIs for instance. But the actual place where most of your serotonin is made is in your intestinal tract. And if the intestines microbiome got disturbed by COVID, as it really does, COVID's a severe disruption of healthy intestinal microbiome, you wind up getting disturbance in serotonin production within the intestines. If you have low serotonin in your intestines and then eventually up in the brain, that causes autonomic dysregulation and also which can lead to something called neuromediated fatigue, okay? So if as part of your illness, sometime in the last 4 or 5 years, you got COVID, I would also try to correct serotonin levels too, all right? So here's what I suggest to my patients. And I have an extensive article on this. I actually think sent an email out about this maybe about a week or 2 ago, but I'll show the article here in a minute too. But the things that I like to do in situations like this is, number one, rebuild and support healthy mitochondria function. And that is to use that ATP 360 by Research Nutritionals product I discussed earlier tonight, 3 pills 1 time a day. Number 2, be on Trifortify Orange or Trifortify Watermelon, which is liposomal glutathione. That helps support healthy mitochondria function as well. And I have people take a teaspoon 1 time a day of that. If the other thing you can do that may give you more immediate benefit is to take creatine monohydrate. So creatine, the thing that bodybuilders use, I'm recommending that here for you too, but let's talk about why. So, your mitochondria, the main thing that they make is a chemical called, not the main thing, but their main fuel chemical is something called ATP, adenosine triphosphate. It has 3 phosphates, okay? And after it gets used, when it's spent, it's turned into something called ADP, adenosine diphosphate, 2 phosphates, okay? Creatine is a phosphate source. And if you take creatine, it will build up in your mitochondria And when ATP gets converted to ADP and it's spent, if you happen to have more phosphate sitting around in your mitochondria, that ADP will grab hold of a phosphate and turn back into ATP and giving you immediate energy. All right. So it's a way of recycling quickly your spent ATP to get it back into ATP again. All right. So the way I like to do that is for muscle mitochondria, it's 5 grams a day. But if you're also having cognitive decline the next day, you might also, instead of doing just 5 grams a day, I would do 10 grams a day. Your muscle mitochondria are a greater hog of creatine than your brain mitochondria are. And so if you only take 5 grams a day, most of it's going to go to your muscles and you're not going to have much left over for the brain. The way to make sure you have enough left over for the brain is to dose it 10 grams a day, okay? The product I recommend for that is Thorne, all right? So support your mitochondria by doing 3 things. That's a creatine, ATP 360, and then the Tri-Fortify product, all right? And then finally, to rebuild serotonin from injury created by COVID, I would look at doing 5-hydroxytryptophan. I prefer a Thorne product for that as well too. And I would do 100 milligrams in the morning and 100 milligrams at night. If you find that you're getting too sedated on it, then you might just make it 200 milligrams to even 300 milligrams at night. And if you can tolerate, sometimes 100 milligrams 3 times a day is useful as well too. Okay. All right. So those are some things to think about. And then finally, to prevent post-exertion malaise while you're trying to recover, you need to find a level of activity you can do that does not wipe you out the next day. So there's a tolerance issue. By trial and error, you determine how much can you do. So maybe you can tolerate 15 minutes on a treadmill, but if you go to 18 minutes, you are decked out the next day. Well, then don't go over 15 minutes on the treadmill. Okay. All right. Let me just show you, do a screen share of that article that I wrote about this. This is the article. So it's Marty Ross MD Solutions for Post-Exertion Fatigue and Malaise. Okay. And in here, I talk about tryptophan for neuromediated fatigue. I talk about dysautonomia. I talk about mitochondria function. I talk about excess cytokines. And then I talk about what you can do. All right. So this phospholipid mix plus POQ10 PQQ is ATP 360. There's the glutathione I was telling you about. And then this is the creatine monohydrate that I was telling you about. Okay. All right. And there's the 5-hydroxytryptophan. Curcumin can help lower inflammation. It can sometimes be helpful with this. And ashwagandha is a great way of supporting your adrenals to help as well too. Okay. All right. Good luck to you, Rebecca. Hello, Renee. Let's see. We recently found out that we have black mold in our HVAC duct vents, and that is why we have been sick for several months with respiratory issues. What can you recommend to help us? Well, so there's a couple. So let me just start by talking about mold and the problems the types of problems that it can cause. So number one, when we are in moldy environments, we may have allergic reaction to those molds. And that is a type of cell in our body called a mast cell. When it sees that there are mold toxins or mold parts, not toxins, mold parts, like parts of mold that break away and you breathe them in, they'll get to the mast cells, and these mast cells react by releasing histamines. All right. Those histamines can give you nasal congestion. They can make your eyes water. They can make it so you have a hard time breathing. All right, that's usually more of a histamine reaction, an allergy to mold in your environment, okay? All right. The second thing that can happen in about 25% of us is that when we are living in moldy environments, we breathe in the toxins or the gas that these molds make. And in 75% of us, our immune system will see these mold toxins when they get breathed in into the bloodstream through the lungs, and our immune cells will break them down. That's what happens in 75% of people. 25% of people, we estimate, have a genetic abnormality where they're not able to break those mold toxins down. Their immune cells do not break them down. And what happens then is those mold toxins then go to the liver. The liver's job is supposed to be to clean out fat-soluble toxins like mold, but the liver doesn't handle mold. It doesn't do a good job with it. And it winds up excreting these mold toxins out into the gallbladder and the bile system. They then get released out into the intestines, and out in the intestines, because they're still fat soluble, they get reabsorbed again. They get put back into your bloodstream again. All right. Now, toxins circulating in your bloodstream trigger a whole inflammation reaction in your immune system, where the immune system makes excess cytokines. All right. I talked about cytokines earlier tonight, but those cytokines disturb your sleep, make you hurt all over, give you fatigue, etc. Okay. So the first thing, if you were to see me, I would want to know, what kind of reaction are you having? Have you been mainly having a lot of allergy and breathing problems, or have you just developed severe fatigue? Have you lost the ability to think clearly? Are you having disturbed sleep? Those things are more suggestive of having toxicity, all right? Now, the way to look and see if you have toxicity is to do a urine test. I like using real-time labs to do that urine test, but you pee, send it off to the lab, and they're going to tell you whether you're peeing out excessive amount of toxins. Earlier tonight, we had a question tonight about whether you need to provoke to enhance your ability to find those in the urine. You can. I still find good benefit in just not spending all the time provoking and using color guards and all that other stuff. I just find people, if they really have them in them, they're going to show up. Okay. All right. But you can make an argument that maybe the night before you do this, you should try to sweat, heat yourself up to mobilize those toxins out of your fat tissues so you have a better chance of peeing them out. Okay. All right. All right. Now, in terms of your environment, if you have found them in your house, that house needs to be remediated. That means your heat ducts all need to be cleaned out by experts that know how to do this. And in addition, I hope that in addition to looking for mold in the heat ducts, they also did a caliper job of looking to see where else in the house you might have mold that might have migrated into your heat ducts. So you should have had a thorough inspection of the house as well too. And it's possible, if your house is being handled correctly, you can remediate a house, but it can be hard to do too. I just have to be honest with you. And so after the remediation is done, I would retest your house again, but I would do it independent of the initial company that did this or the people remediating. And the way I would do it is to get a dust sample study, a technique called a Herxheimer, HERTSMI, which involves taking a cloth they send you, wiping down an area, and they're going to be looking to see, are there excessive mold spores in there? Because not all remediation works. And you're going to want to make sure you really got this stuff out. Okay. All right. And so the company that you can get your Herxheimer test kit from that I like using is a company called Mycometrix, MYCOMETRIX. And after a home gets remediated, I want people to go through that home and do their own Herxheimers to see, did the remediators really get rid of it? And I would sample probably 2 or 3 rooms in the house. Okay. All right. Good luck to you, Renee. Renee, let me just show you, in case this is all new to you, let me show you an article I have about mold toxicity here. That's this article right here. Okay. All right. Good luck to you. Hello, Gene. Just discovered mold in my house and have some Lyme inflammation sometimes. Your recommendations to minimize impact while waiting for fix to the house. So, Gene, I guess I'll just carry it. This is part of the previous discussion as well, too. Don't assume you have a mold problem in you. All right. So you may not be a person that has allergic reaction, and you may not be one of the 25% that develop mold toxicity issues. And so I would, to see if you are one of the people that have mold toxicity issues, I would get a urine test, right? Now, if you want, you could start binders, but it's not clear to me you need to, because you may not be a person that has problems with mold in your house. All right. Also, if you just found it and you happen to be a person that has problems with handling mold toxins, it'll take about 2 weeks to get your urine mycotoxin test back. And if you've already been exposed for a long period of time, waiting 2 weeks to start doing something about it is not going to make a difference on your outcome. So I don't know that you need to do anything yet. I'm not clear that you need binders. I'm not clear that you need anything else, but I would be looking to see if you are a person that has mold toxicity issues. Okay. All right. Good luck to you. Hello, Glenna. Hold on here just a minute. Let's see. Hi, Dr. Ross. After many years of diagnosis and antibiotic treatment, I was doing very well on immune supplements by research nutritionals that was discontinued a while back. At your advice, I switched to the 5-mushroom immune builder, which is now discontinued. I know we seem to have a record of that here, don't we? Let's see. I've tried the 5 defenders by Real Mushrooms, and I Herx on it. I tried one a day, even every other day, but there is still too much die-off. It is Bartonella that haunts me. When I was treated, my prescriber did pulsed therapy. This was successful for Lyme and Babesia, but not Bartonella. I did your herbal protocol for Bartonella in 22, and since then, I was doing great on the immune supplements until this last discontinuation. Also, I used infrared sauna therapy. Do you recommend cryotherapy? I never used it because I was afraid it would just send the Bartonella into hiding. I feel much better in cold weather, and I always assumed that was the reason, but would love your advice on this too. Thank you. All right. So Research Nutritionals had a product called Lyme Plus that was transfer factors that would stimulate your immune system to fight the various tick-borne infections, okay? And then they got it discontinued, all right? So then I started advising that people to boost your immune system, you start working with mushrooms, and the primary company I used that had a mushroom mix that was useful, they stopped making their stuff too. As I said earlier tonight, I'm starting to recommend for people for immune boosting that you look at this a peptide product by Integrative Peptides called Thymogen Alpha-1. It's made of 2 bioregulator peptides that are designed to get your thymus gland, which sits here in the chest, to work better, to produce chemicals that will help boost your immune system. Your thymus gland is your big immune organ, okay? As adults, it tends not to be so active, but we can get it turned back on using the bioregulator. So that's how I do it these days. I would do it 1 pill twice a day, and it's that Integrative Peptides is the product I would recommend for that, okay? All right. And then, so in terms of hot and cold plunging, cold therapy is very useful at balancing out your autonomic nervous system. Now, if you happen, it's not going to be germ killing. No, I want to be clear about that, but it balances out. It causes an autonomic nervous system rebalancing. And so for some people, as I alluded to earlier tonight, part of your brain gets stuck in an on position when you have chronic infections. That's the limbic system. And one of the things that it elicits then or causes is your autonomic nervous system to be stuck more in an on, frightened kind of position, all right? Anything you do that will be more parasympathetic or anti-adrenaline can be helpful. Believe it or not, cold plunging or doing cold therapies is a useful way of eliciting that kind of a response. So could it help? Yeah, it could. I have no problem with people doing that. Okay? All right. Good luck to you, Glenna. Hello, Ron. Let's see. Thank you for your time. I have a very sensitive stomach to antibiotics, both prescription and herbal. Are there any supplements that would help to protect the stomach and alleviate these symptoms? Yes. So when I've got people that have sensitive stomachs, I'd like to have use licorice, believe it or not. But I like using a type of licorice which is called deglycerated licorice. And you chew tablets of this deglycerated licorice, and you chew it about a couple tablets 3 or 4 times a day. You might make the times that you chew them right before you take your medications. When you chew licorice tablets or tablets that have licorice in them, your saliva and the licorice interact together, and it creates a microscopic gelatinous coat or barrier that protects the lining of your stomach from being irritated by these things, also your food pipe as well too. The products that I carry that have this licorice in it are products made by Integrative Therapeutics, not Integrative Peptides, but Integrative Therapeutics. And their licorice products are called rhizinate. I'll show it to you here in a minute. They have a sugar-free one or a fructose-free one, and then they have one that's sweetened with fructose, okay? But you do a couple of those, chew 2 tablets 3 or 4 times, but make it some of the times before you take your tablets, okay? All right. Second thing is, when you're doing your herbal antibiotics, usually I prefer herbal antibiotics as tinctures. Those tinctures, the active plant is extracted, or the chemicals of active plants are extracted into alcohol. And alcohol can be irritating to a stomach lining. So the one thing you could do with your alcohol-based tinctures, if you're somebody that is very sensitive to the irritation of the alcohol, is you can steam off some of that alcohol before you take them. And the way you do that is you boil water, and then you set aside maybe 1 ounce or 2 ounces of it, and you place your tincture drops into the boiled water. That heat will cause most of the alcohol to steam off. And as it cools, you can drink it. And then that becomes something more tolerable to the stomach as well too. Okay. All right. And you could even make up like a whole day's worth of your herbal antibiotics. Let's say you do 3 different herbal antibiotics as tinctures. Just boil up 2 ounces of water, put all of the drops into that 2 ounces, divide it into, you have 2 1-ounce servings that have a morning dose and a nighttime dose as it cools. You just drink them. Okay. All right. Good luck to you, Ron. Hello, Deborah. Let's see. Being treated for Babesia microti, Bartonella, chronic Lyme since August of 25. Had persistent Babesia symptoms. Currently on atovaquone, 750 twice a day, doxycycline, tefenequine. Did a 600 milligram loading dose last week. And next, And next, 300 milligram per day. My provider stopped azithromycin. Wonder if I should restart this. So far, my symptoms are improving after the loading dose. Okay, let me go back here. So your current regimen is atovaquone, doxycycline, and then tefenequine. Okay, so tefenequine, some people do give a loading dose on it, and that is to take 200 milligrams. One way to do it would be 200 milligrams daily for 3 days. Then you start going into a regular regimen once a week, okay? And I assume that's what you mean by the 300 milligram. I hope your provider is not having you do 300 milligrams daily of tafenoquine. I wouldn't do it that way. Once you get it at a maintenance dose, it should be weekly. And the reason is tafenoquine has an extremely long half-life. And that means it takes forever practically to get cleaned out of your system. In fact, when you take tafenoquine, it will take 2 months from your last dose before it is completely out of your system. Okay, that takes a long time. Things that take a long time to get eliminated can build up to super high doses and get toxic if you're taking them daily. So I would not recommend after you've loaded the tafenoquine to get up to an adequate level that you keep taking it as daily. I suspect what you meant is 300 milligrams each time you take it once a week. That's usually, we would do tafenoquine on an ongoing basis is either 200 milligrams one time a week or 300 milligrams one time a week, okay? All right, now, when using tafenoquine, sometimes by itself alone, it will be enough to get rid of Babesia. It's a pretty strong agent. If it's not strong enough, then we want to combine it with something else. And often I like doing that with atovaquone. You could also combine it with azithromycin, but a substitute for azithromycin would be doxycycline. So your tetracyclines like doxycycline and your macrolides like azithromycin help get rid of Babesia, but the main agents are going to be your tafenoquine and atovaquone. Since your provider has you on doxycycline, I do not think you need to be on azithromycin here, okay? All right, those are interchangeable as far as I'm concerned, okay? All right, good luck to you. Charlie says, I'm fully connected and the video works. Thanks, Charlie. I know, I'm just seeing this. I mean, it just shows you how long it took me to get down to this part here, but thank you for letting me know that. Hello, Nora. Let's see. Steps to recover from mold, and will I ever feel safe in a home again? Yes, you will. And I think we talked about it a few times here tonight, but number one, you got to get your home cleaned out, okay? Number two, if you have mold toxins in you that you've determined are in you by doing urine mycotoxin testing, then you need to actually do something to grab hold of them in your intestines so they don't get reabsorbed again. Now, depending on which mold toxins are in you, sometimes there are specific binders we might use. So for instance, if it is just black mold toxin on its own, which is called trichocethine, and you don't have any other mold toxins, activated charcoal would work. If you happen to have gliotoxin by itself and there are no other toxins in you, bentonite clay would work. But if you have a number of those toxins that are in you, then you want to use a broad spectrum binder like a Mycopol or a GI Detox Plus. That last one is made by Biocided Botanicals, okay? And usually I will start my binders at 1 pill 1 time a day. And if somebody's tolerating it after a week or so, I might go up to 2 pills 1 time a day. When you do your binders, you got to make sure you don't take anything else with them at the same time because they're binders, okay? So you don't want you want to make sure that you stop all other medicines and supplements beginning about beginning 30 minutes before you take them. And then you can resume taking your medicines and supplements 2 hours after you take your binder. In terms of when to eat, you can eat anytime around when you have your binders. But an ideal time to have something, a small amount of something, is about 30 minutes after you take the binder. And the reason for that is whenever you eat something, it causes your gallbladder, where toxins are stored, to contract, squeezing them out into the small intestines. And where the gallbladder squeezes stuff out is about 30 minutes south of the stomach. Okay, I hope that analogy makes some sense for you there, all right? All right. And then you're going to bind and you're going to do that. And the other thing you want to do to decrease inflammation caused by the mold toxins, you want to get on curcumin. The product I like for that is a product by Thorne called curcumin phytosome, 500 milligrams 3 times a day. I might also have people on glutathione as an antioxidant that helps lower cytokines as well too, the inflammation chemicals. And I would do a trifortified liposomal glutathione at a teaspoon a day. All right. Now, after you've used your binders for about 4 to 6 months, you want to come back in and retest again and see, are you making any headway? If you are not making headway, then you have to be concerned that you're either being poisoned by your house still, even though you might have had it remediated, or you have not been using a binder that's effective, or that you might be colonized with mold spores that are living in your nose or your intestines that are producing the toxins, okay? Now, some of my colleagues, when anyone has mold toxicity, they right away put them on binders and they right away put them on mold spore killers using itraconazole or fluconazole. I don't do that. 80% of the time in my experience, in my Seattle practice, I never have to put people on mold spore killers because they don't have a problem with being colonized and the colony is producing toxins. Rather, they have a problem that too many toxins built up in them and we just have to remove them, okay? All right. So those are some of the basic steps. Let me show you my article. I showed it earlier tonight, but I'll show it to you again. I would read through it where I outline this approach for you, okay? So this is the article again. It's called Mold Toxin Illness and Tick-Borne Diseases. And down here, wow, that is a much younger looking me right there. I just realized that. But anyway, I talk about the testing and why I like using real-time labs to do this. I talk about different binders you can use. I even have a table here. And then I talk about antifungals and that I don't agree with using them right away, but sometimes I will, okay? And I talk about where to start, okay? So take a look here and that gives you the useful information you need, okay? Good luck to you, Nora. Hello, Ron. Let's see, a second question, if I may. If someone is exposed to mold toxicity in a home and then relocated to a dwelling without mold, will the body then eliminate the toxins? Not necessarily. Again, mold toxicity is an issue of your immune system not working correctly to break the mold toxins down. And just moving to a house that no longer is exposing you to mold toxins does not mean that the genetic problems leading to your immune dysfunction are going to fix themselves, right? So probably not. Okay. All right. Good luck, Ron. Hello, Charlie. Do you see recovery from mold and chemical sensitivity after treating yeast fungus in the body after treating Lyme? Yes, I see that. And some people, you got to treat their mold toxicity and their tick-borne infections at the same time. But can a person recover? Absolutely. Okay. All right. Good luck, Charlie. All right, hold on here just a minute, everyone. See, Rebecca says, do you recommend lithium for Lyme dementia? At one time I might have. I don't these days because I've learned a lot more about dementia or problematic thinking when you have tick-borne infections. These days, my approach to people that have thinking problems involves a few things. Number one, and this is based on a protocol called the Bredesen protocol. Bredesen has pioneered a root cause approach to managing Alzheimer, mild dementia, plus also early Alzheimer's, that involves doing lifestyle and also infection and toxin treatment that is much better than any prescription medicines you can do. They've done studies looking at improvements that happen through this, okay? So the key things you want to address with any kind of dementia, especially Lyme dementia, is number one, get 7 to 9 hours of sleep a night. That helps restore brain function, can even get you thinking better, lowers cytokine inflammation, okay? So number one, get 7 to 9 hours of sleep. Sometimes that takes doing lifestyle modifications to make that happen. Key things that help get you to sleep are scheduling the same sleep time each night, stopping all caffeine before noon, getting rid of all alcohol, trying to have a cool room, getting rid of your blue lights, meaning your devices, your TVs and your computers about an hour or so before bed, okay? So that's number one. Good sleep hygiene with the target of getting 7 to 9 hours of sleep a night. Number two, look at the intestinal microbiome. Do studies to make sure that you don't have imbalances in the good bacteria there. Inflamed intestines lead to inflammation in the brain, which is part of dementia. And so the testing I like doing for that is I'm moving most of my testing of stool these days, microbiome testing, to a lab called Jona, Jona, and they're at jona.health, jona.health, okay? That's the URL. They don't have a .com, it's .health. And what Jona is doing is they're doing a type of analysis of your microbiome called shotgun sequencing or shotgun DNA sequencing, where they literally carve up all the stuff in your poop, and they see what are the genetic patterns that are there, and they compare it against a known database of any germ anyone has ever had in their intestines that shows up in research, and they use AI to figure out what do you have in you. Right? It's more comprehensive than any other lab out there, okay? Then, after they figure out what's in you, they then look and see what do you need to do to adjust that with food or probiotics or vitamins to get it so it's more conducive to helping you think better. Okay, all right. So number one, get sleep. Number two, do good evaluation of the gut microbiome. Number three, look to see which infections are active and what toxins you have, mold toxicity, for instance, and Lyme, Bartonella, et cetera, and treat those infections, okay? Number four, make sure that you support your mitochondria. The mitochondria are power factories of every cell, including the power factories of your brain. We know from research that when you have dementia, the mitochondria are injured. It goes side by side with them, okay? And so for the mitochondria support, I like using ATP 360, 3 pills 1 time a day. I mentioned that earlier tonight. I also like working with creatine. I mentioned that earlier tonight too, at 10 grams a day, because that recycles used ATP back in, or ATP, which becomes ADP back into ATP. ATP is your cell fuel, okay? And then I also like using glutathione as part of that as well too, okay? Those are the key things I like to do for dementia. So it's not one pill that's gonna suddenly make you think better. It is looking at sleep. Oh, the last thing, be on a low inflammatory diet. And for that, I tend to like using a Mediterranean style diet as well too. Okay. All right. There you go. Lithium may help, but it's not going to get at the full picture basically. Okay. All right. Good luck to you, Rebecca. All right. That's it for tonight, everyone. I've had a good time being here with you. It's good to be back after 2-week absence, one of those weeks caused by technical malfunction. But I'll be back here with you again next week and the week after. We've got time scheduled. Tomorrow morning, I will send out an email that will have a recording of tonight's webinar. And I ask that you share it with everyone. Yes, there's other people you know that have tick-borne infections. I am sure will get benefit from what we're doing here. So please share my videos on the email when that goes out to you tomorrow, okay? And then, let's see. Oh, in tomorrow's email, you'll also be able to sign up for the next webinar, okay? And then finally, for those of you that want more advice than I'm able to give in these kind of questions, feel free to set up an appointment with me. So through my clinic, which is Marty Ross MD Healing Arts, I am taking appointments, all right? So this is my clinic, martyrossmd.com. And on my appointments page, you would see how to do this. One of the type visits I'm offering are these remote educational consults where I can ask you a lot of questions. You tell me a lot of things about yourself, and I suggest some things you can do to help improve your condition. Okay. All right. So feel free to take a look at this, everyone, as well, too. And with that, I think I am done for tonight. So good to see you, everyone. Good night. And I hope you all have a good week. Bye-bye.